Good afternoon, everyone. Thank Dr. Gitumani for including me in this course and AIOC for accepting the course. So my topic is instruments, cleaning and sterilization. Infection following ophthalmic surgery can lead to permanent vision damage and functional disability. And a major source of infection in eye surgeries are the very instruments that we use during the surgery. And therefore, proper cleaning and reprocessing of surgical instruments is of utmost importance. Reusable instruments are usually made up of stainless steel or titanium, where alloying is done with chromium, nickel or molybdenum to decrease the risk of rusting. Stains and irregular surface increase the risk of debris and organic matter deposits. Presence of such may prevent the destruction and may inactivate some of the disinfectants. So the first step is inspection. After each surgery, each instrument from the set should be carefully scrutinized for defects, debris, etc. under a magnifying loupe or a microscope. We should not allow tissues, blood, irrigating solutions, viscoelastics, or medicines to get right on the instruments, especially in the cannulated equipments. Next step is the cleaning. After a case is finished, the blades are cleaned and cannulated instruments are flushed at the point of use, then immediately washed under running water. And then cleaning is done by the 4-bowl technique or using an ultrasonic cleaner. In the 4-bowl technique, the instruments are double dipped in chlorhexidine cetrimide solution in the 2 trays where the cleaning is done, and then rinsing is done in another 2 trays filled with distilled water. Thorough cleaning of the instruments is done with the help of a toothbrush to remove all the debris. Should not use metal brush, steel wool or abrasive powders for cleaning, as they destroy the finish and on the instruments and may lead to corrosion. Special attention to the joints, locks and serrations in the instruments must be given and cleaned well, because these are the places where corrosion starts and debris may accumulate. Enzymatic cleaners like proteases can also be used where there is excessive debris or in case where immediate cleaning may not be possible. Ultrasonic cleaners, which are high frequency sound waves, are used to dislodge the tissue and other particles adhering to the instruments while it is soaked in distilled water or recommended solution. This can be done, but while keeping the instruments in the basket, we should make sure that they do not touch each other. Next step is the drying. The instruments are dried by aeration or hot air, because all moisture should be removed before we go for the next step of sterilization, and we should never wipe them with a cloth. Following this, the storage part comes, where the surgical instruments are usually used as a set, like a cataract set or glaucoma set, and so instruments belonging to a particular set should be placed in the respective trays on a clean linen or silicone mats. Trays and instruments should be marked in similar codes so that they are not interchanged. Pointed tips of the blades, scissors, etc. should be tipped with plastic sleeves. Moving parts, joints, locks, etc. May need lubrication, which can be done using surgical grade silicone or Teflon spray. And before doing lubrication, the instrument should be free of all debris. Packaging, all the instruments need to be packed before they undergo sterilization so that the sterilization is maintained after the procedure is completed. And the packing varies depending on the method of sterilization used. For steam autoclave, the instruments are placed in the trays and then covered with cloth, and then it is placed inside the autoclave. For ethylene oxide, the instruments are placed inside the plastic bags and then sealed. Coming to the sterilization part, steam sterilization, dry heat and ethylene oxide are the most important forms that are being practiced, in where steam sterilization or autoclave is dependable, non-toxic, inexpensive, sporicidal, and can penetrate the fabrics well. Dry heat or hot air oven is done for articles which can be damaged by steam, like sharps, oils, ointments. Ethylene oxide or ETO, this provides low temperature sterilization for heat sensitive articles. Chemical sterilization is not recommended, and flash autoclave, though in the AIOS guideline it is mentioned, it depends on the institution. It can be practiced, may not be practiced, but steam autoclave is the one which is most important, and the instruments should be used within 48 hours of sterilization. For sterilization in between cases, autoclave can be done for 5 minutes, holding time in high-speed autoclave at 134 degrees temperature and 30 pounds pressure, or in regular autoclave with holding time of 20 minutes after attaining the required temperature and pressure. The instruments are cleaned in distilled water using the 4-bowl technique. The cleaning water should be changed after cleaning 4 to 5 sets or earlier if it appears soiled. Ethylene oxide gas sterilizer can be used for disposable surgical blades, refines, retinal probes, lenses, eye drapes, eye shields, other plastic items. We know that it is toxic and potentially explosive, so due to its toxic nature, an aeration period of minimum 72 hours for the sterilized items is a must before using. A microbiological control is mandatory, and this sterility is maintained in the original packing. There is also a hydrogen peroxide plasma sterilization system, as it is very expensive, so it is not much in use because it takes around 75 minutes and it needs special packs for it. Now coming to the indicators which measure the efficacy of the sterilization, and they help to keep a record of the sterilization process and sterility achieved, and an indicator tape which mentions the tray number, autoclave number and the date with the proper signature should be there. Coming to operating room and corridor, no sweeping, only dry dusting should be done. Daily OT floor is wet mopped with 1% sodium hypochlorite solution using 2 or 3 bucket technique. One bucket contains plain water and the other hypochlorite solution. The mop is rinsed in plain water, soaked in hypochlorite solution, and then mopping is done. Hypochlorite solution should be prepared just before use. Fumigation can be done with 30 ml of 40% formalin in 90 ml of distilled water for 1000 cubic feet by aerosol spray. The OT is closed for 24 hours or for 6 hours if followed by carbolization by 2% carbolic acid. If fumigator is not available, 35 ml of 40% formalin in 10 grams of potassium permanganate can be used. Carbolization is done with 20 ml of Corsolex mixed with 980 ml of distilled water. For a new OT, at least 3 fumigations on consecutive days and 3 negative cultures are needed. And for a running OT, once a week is enough, but if load is very high, more frequently it should be done. At the end of surgery of a grossly infected case, and other options available are aldicol, which contains formaldehyde, glutaraldehyde, and benzalkonium chloride. Agents like bacillocid ruscent, EcoShield can also be used. In bacillocid ruscent, the sepsis can be achieved in 30 to 60 minutes. And also one important thing is the UV radiation. Daily UV radiation of 12 to 16 hours is recommended, and it has to be switched off 2 hours before entering the OT. Microscopes are cleaned with 15% cetrimide and 3% chlorhexidine gluconate daily except the lens. Microscope knobs autoclaved and changed after each case. Lenses cleaned weekly with lens cleaning solutions. Tables, saline stands, and surgeon seats should be cleaned daily with 1% sodium hypochlorite or antiseptic. Fans, lights, etc. in the OT to be wiped once a week. Washing of the OT walls, tables, trolleys with detergent to be done weekly. Tables, saline stands, revolving chairs should be cleaned daily. AC filter must be cleaned once a week with detergent. Servicing of AC needs to be done every 3 months. Finally, the documentation, each and every step of sterilization with proper documentation, date, signature is very important. So to summarize, surgical instruments should be sterilized after each case. Instrument set once opened is considered contaminated even if it's not used. Sterilization technique should be followed strictly. Regular maintenance of sterilization equipment is essential for the proper functioning. Indicators should be used with every set, lingual elected bottles, etc. And finally, documentation of each and every step is a must. These are my references. Thank you.